I acknowledge the participants in the study, my collaborator, as well as my colleagues and local community in which I worked. Thanks. Next slide. I've really been asked to talk on a very, very complex concept, but just to introduce my talk, decolonizing is a process of conducting research in a way that the world views of the oppressed and marginalized are given space to communicate their frame of reference. Now, this is by Chilisa 2020. On the other hand, Zavala 2013 states that decolonization is also not about the struggle for a method, but about the spaces, conducive spaces that make the process possible. Now, in this presentation, I will use examples from my qualitative research project, which I conducted in a marginalized urban Black township, which still bears the marks of the oppressive colonial rule, even post-democracy. I must declare that I did not use indigenous research methods per se, but from engaging with literature on the topic and from hearing my participants' stories on how epilepsy affects their life. This sparked my interest to look deeper into the stories and look at what I'm hearing from the analysis, thematic analysis of their stories. And this is where issues of power, trust, respect came about. Next slide, please. I'm going to talk about the issue of power. Because I'm also a healthcare practitioner, I will also refer to the routine health system and how it operates. Dynamics of power in research and participation are about who talks, who acts, and perhaps these can be unpacked when we use all key questions of Kipling: the what, the who, the why, the how, the when, and the where. Power can be in favor of the researcher, the funder, because the funder has resources, and sometimes the funders direct us on what to do, which may not even be applicable or legitimate in what we are trying to investigate. The supervisor, from my experience as a lecturer, I found that sometimes, power of those who supervise can also affect the research process. The review ethics, especially on the guidelines that are being set, you have to follow a certain guideline for your paper to be accepted for publication. And sometimes you find that reviewers' comments are not in favor of what you are raising. From perhaps my African lens, this might not be some things that are really pertinent or important to the review ethics. Language, politics, age, gender, and class, etc. This is, however, often heard from perceptions of researchers. For example, the issues about power, like from myself, probably, from reflecting on these fieldwork issues, issues of power emerged. And perhaps most often, when I reflected upon this, that did we look at participants' perspectives on the issues of power? So in a research process, power can occur in many ways, from identification of the project, the conceptualization and design of methods, that we decide to use in field work, especially the criteria that we set for inclusion and exclusion of participants, and the settings that we choose. Now, I want to just share with you briefly that when I embarked on my project on epilepsy, I was actually going to do it in one of the townships, peri-urban townships in Cape Town. But on talking about my project in different meetings, that's where I met one of the key stakeholders from this township where I did my research, who said to me, Johannah, why do all researchers go to Khayelitsha? That's a peri-urban township in Cape Town. Very few come to our research center. So after meeting with the stakeholder, I had to reflect deeply upon this. And because I did not know the township per se myself, so I was even afraid to go there because I did not know how I will enter, who I will meet, what the place looked like. But then with the support of this stakeholder that I met, I was convinced that I will be able to do field work from his support. Now, from this experience, I realized that, the researcher also has a power of deciding on the setting. And sometimes we never think about the inequalities that we do when we select the settings in which we do the context, because that's where we are comfortable and we want to be comfortable. So the issue of just in a nutshell, and then the issue again about power, why it emerged was perhaps because of my own experiences of oppression in South Africa, as an African woman, also as an African born and bred in the country. And also that my study was in this urban township that is much where the group of people that I was conducting the study with still marginalized in terms of access to available support services and the treatment and care. So these issues of power became obvious when I examined my own subjectivities around the topic and in field work. Next slide, please. So in my interviews and focus group with traditional healers, power issues that emerged were about the lack of interest and commitment to have MOUs, Memorandum of Understanding, or formal agreements between the traditional healers and researchers. And I found this very, very concerning, especially because the traditional healers shared with me that the formal agreements would be useful in terms of protecting their knowledge, their intellectual property, but I will talk about it later. From my observations again in the interactions between patients with epilepsy and some healthcare practitioners during their routine clinical follow-up visits, I became aware of power of the routine task system, where the healthcare system operates in a way where the patient have no say according to rules and regulations, which the patient, whether the person likes it or not, must abide by what is happening. So I found that the attitudes of some healthcare staff, the power of language, lack of listening, and disrespect were some of the issues that came to the fore as I followed up and observed the interactions in the healthcare system, because my research was informed or guided by Bronfenbrenner's socio-ecological theory, So I wanted to look at all levels of care where patients interact at home, in the healthcare system, what actually happens there. So my study actually used that theoretical approach. I also learned about the power of metaphors, something that I never thought about. When one of my interviewees said, you know, when you are in this clinic and you ask a particular question, you know, you'll get answers like, or they will look at you as if you are a grave. I've got a published article on that. And when I reflected on what is a grave, how can a person say to someone that you look, or look at somebody as if this person is a grave? A grave has no power. So it made me to understand how it feels to be powerless and to be emotionally harmed in a healthcare system where you have the right to be respected, to access your treatment, and to be treated appropriately. Next slide, please. One of the most concerning issues in my field work experience was the power of stakeholders, which came to the fore. You know, when you give feedback of findings in different phases of the project, you as a researcher, and if you want to be ethically and morally correct and act in the interest of the people where you are doing, of the or communities in which you are doing research, you need to be upfront and to be transparent about the actual findings, what you have heard, and what should happen. So I became aware that on reporting such findings, you know, to say, of course, there are no epilepsy support services here. Even when reports are mentioning that people are having services in their setting, but on getting into the setting and going around, there were absolutely no such services. Now, when on reporting those kind of findings, I found that my relationships with some key stakeholders were affected. Now, the questions for us to ponder as researchers are, what are we doing research for if we can't report the truth? What kind of things should we report? Should we report those that are truthful or minimally truthful or untruthful or misleading so that you can get support? Or we must report in that way, untruthful ways, to so that our actions and our findings perpetuate an ethical research practice. So those were some of the questions that came to my mind when I was reflecting on my fieldwork. Next slide. Now, the issue of respect is one of the issues that really concerns me during fieldwork. Respect in a decolonizing process is about relationships. This is important because sound and respectful relationships can enhance co-production of knowledge. So in South Africa, literature shows the Sen Code of Ethics that highlights the ethical principles among the Sen community has been established. Why? Because this was important for them to guard against exploitation of this community. So this was something that was exciting for me that I read from literature. Now, from my interviews with traditional healers, I learned that collaborative efforts between the healers and some Western trained biomedicals with whom they interacted failed because of lack of respect of their knowledge about healing practices. Because they treat epilepsy in a holistic manner that is not scientific, a manner in which we cannot understand because it is not written in scientific books. And it is something that goes through a process of an ancestral process where they are called. It's a calling for them. So one healer said, our concerns as healers is that we are willing to share our knowledge. Just listen to that. Willing to share the knowledge about indigenous plants that we use to treat illnesses. But after we give information to the researchers, we did not hear about the results and how those plants have been processed into medicines. We did not see our names on the labels of the medicine bottles of the plants that we have provided. Next slide, please. Still on the issue of respect. Now, after this healer's quotation, I perused literature and I found a review article on the use of traditional treatments. Now, I'll just quote parts of the conclusion section of these authors. You know, it continues like this, that these traditional plants or medicine, this could be a business opportunity for companies developing traditional medicine products. Now, the question here is, who then benefits from this business opportunity? Through whose knowledge does this become a business opportunity? I'm raising these things because we are looking at issues of decolonization. Now, I also reflected upon Nemashina et al. When they state that Africa suffers from a resource curse of collectors of knowledge and cultural artifacts. So the question is, should we as researchers be viewed as collectors of knowledge or people who steal knowledge from others? These are pertinent questions for a decolonizing research method. From this, I echo what Masango 2010 cited in my article said when he states that stealing and exploitation of indigenous knowledge can be protected with the intellectual property rights. So these are some of the issues that we need to look at in our in the steps that we take in a decolonizing research process. Next slide, please. Next slide. Now, the question for this symposium was, what should a decolonizing research method look like? Well, I don't promise to have answers. I am not a decolonization specialist or expert, but I take part in conversations around the issue. So firstly, thinking about this question, decolonization is complex. It's a complex term, and it is difficult to explain. I've got one colleague of mine who's doing PhD who asked me last week, what does the term decolonizing or decolonization mean? Then I said, well, you are asking me a very, very interesting question. I'm actually going to present at the symposium. But for me, is the way your conscious, how you use your conscious in the process of research to look at issues deeply and to actually commit to bringing the issues that affect people to the fore in a most humane and respectful manner. So that's what it's transformation of how we think and how we act. However, when I looked at Smith 1999, the questions that she posed, I thought these could help us to guide us on how a decolonizing research method should look like. in our different contexts, because our contexts are different. Now, the questions asked, some of them are, whose research is it? Who owns it? Who designs it? Whose interest does it serve? Who benefits from it? Who sets the research questions? Who carries it out? Who writes it up? What actions can the research take if the outcomes are contrary to their needs? So I thought these questions are quite important. Perhaps these are some that we must consider when we think about how a decolonizing research process or method should look like. Next slide, please. Now, on ending my presentation, I read a very interesting presentation by Chiumbu, who was presenting this paper at a seminar, HSRC seminar. Sorry. And he says, just drawing from what I said in the previous slide, according to this author, we will, if we do so, if we look at the questions by Smith, we will be able to design research methods that speak to the realities of the people, the methods that are interactive, that are participative, that are emancipatory, and that are ethical. Thank you for listening. This brings me to the end of my presentation. Thank you.